Hi, it's Chris here from FuseIT. Over the next 2 days, I'm going to be at the Digital Health Festival in Melbourne, Australia. We'll be learning all about what's happening in the health industry, and I'll be reporting back on what I learn and what I find most interesting. So some of the things that I've really been enjoying listening to today is how the healthcare system is changing. Where people might have once been receiving care in traditional buildings, organisations are now looking at how they can run that beyond buildings, without walls, and with providing in-home care and providing the digital apps and systems to make that possible and to make that efficient. Some of the great success stories that I've been hearing today have been around how people have been designing for the consumer journey that the patients are experiencing. Not just looking to solve one particular problem in isolation or one silo, but thinking about the whole design of the systems and using systems thinking to bring together all of the different parts of the service that is needed to be provided. Here was one take from a panelist I heard today. ChatGPT knows more about my health than my GP or my hospital record does. It goes to show that people are putting a lot of faith in big tech. Today, more than ever, when people are seeking help, whether it's for health care reasons or maybe it's for aged care or looking after a loved one, there's a lot of information they need to look through and a lot of decisions to be made. Currently, they feel underserved because they have to look at lots of different websites and bring information. They have to check eligibility rules. They have to download PDFs and application forms and fill them in. If we're going to do well in modern healthcare, we need to reach them where they are already and help them to show the next best action for them based on the information they know. These people are often being supported by family members. Bringing the family members into the conversation and giving them the information as well can make it easier for everybody. It's day 2 here at the Digital Health Festival in Melbourne. Yesterday was all about how the industry saw itself, with care coming home and AI finding its feet in healthcare. Today it will be interesting to see some of the harder stuff. Who pays for it? Who's building it? Something that came up again and again today is that in healthcare, decisions aren't just made by one person. They're made by families. It could be an elderly parent choosing for their child, or it could be adult children choosing for a parent or a spouse. One thing they all have in common though, they're all scared. They're all acting on limited information. The websites and digital experiences that are out there are designed for one user at a time, not for a family navigating a hard decision. That's the gap. Best line I heard today: stop asking consumers to come find your service. Find them where they already are. Most health websites still make people navigate eligibility, forms and jargon before they can get help. The window for someone to ask for help can close in minutes. Someone on stage today said virtual care now sounds like online banking. It's quaint, because of course it's online. Digital used to be an enabler of care, and now it's the platform that care is delivered through. If your digital experience is bad, your care is bad. They're the same thing now. So I think care is the one industry where customer trust starts high and you can only lose it. Every other industry, you have to earn trust. In health, you get inconsistent experiences or a confusing website or a different message when you're at reception, and trust is lost. Having consistency across every touch point isn't it nice to have? It's the whole job. Here's my read on AI and health after the day of talks. It's narrower than the hype and bigger than the skeptics want to admit. So ambient AI scribes taking medical notes and creating note summaries are all real and working and saving hours every day. But other things, many of those are still in pilots. The interesting question isn't what AI can do, it's what it plugs into with the rest of the enterprise. You've got to have your data, you've got to have your infrastructure there to support your AI outcomes. And that's a wrap on the Digital Health Festival for this year. it sounds like the industry knows what the challenges are. Care needs to feel human and personalised. There needs to be transparency in data and equity in accessing care. The gap becomes that execution. So for people who are delivering that across a website or a digital front door, a telehealth or a clinic, a family conversation, those are the people who are succeeding.